Session 2, we have Professor Jung-woo Koo from 성균관 University as a moderator, and we also have 3 paper presenters and 7 designated discussants.
Hello everyone. My name is Jung-woo Koo. I'm teaching at 성균관 University. I'm a sociologist, and I was in charge of reviewing papers from the presenters who are sitting over here. And as Professor Jung did, I took a look at the papers and trying to provide feedback to help them revise the paper. And I'm on the board of a journal, a medical journal, and then I get the papers from many authors, professional authors, and provide comments like as a reviewer. And I did the same thing for all 3 papers, pretending that I'm a reviewer for a journal, and suggesting that all the papers submitted were really good quality papers, and I was very impressed by the quality of it. And I was hoping that you would be able to keep revising the paper to make the papers more qualified and the ones. That being said, I feel like we've got a unique set of papers that will be presented for the second session. I feel like the nature of the papers that will be presented for the second session are a little bit different from the ones that were presented for the first session. If we can say that the first papers focused on more traditional arena of sustainability, that is more focused on economic arena and environmentalism. The papers we're about to see are focused more on not traditional areas like medical. Medical sustainability, and then sustainability regarding fiscal sustainability. That's the other one that will be presented. And we've got the third one, which is more comprehensive coverage by Carol Kim, which is a more comprehensive treatment of what sustainability might mean, and then what would be more systematic approaches to make use of sustainability in a more efficient way. So I had to ask Carol Kim to go ahead and present the paper first, unlike the planned schedules, because I thought that you could go ahead and provide more sort of more solid ground in terms of understanding what sustainability means, what would be better policies in terms of enhancing the issue of sustainability. So you might want to go ahead, and then followed by 2 papers that deal with medical sustainability and fiscal sustainability. Professor Chung already set the rule, and then my understanding is that the rule must be obeyed. So I'm not trying to make new rules. And discussant, presenters will take about 15 minutes to complete the presentation, and then followed by designated discussants who will take about 5 minutes to deal with each one of the issues. And then I'll open the discussion for the floor, and then taking questions for the floor. I'll try to minimize my role because I already gave you a lot of comments and feedback on the papers. Alrighty, let's begin with Ms. Carol Kim, who will be presenting the paper titled "One Image for Today's Youth: Unifying the World by Creating a Sustainable Future Through Social Networking." Let's welcome Ms. Kim.
Good afternoon. My name is Carol Kim, and I am a student at Brown University. The title of my paper has been revised a bit since its first draft. My paper is now titled "The Effect of Corruption and Environmental Performance on Economic Sustainability and the Role of Social Networking in a Vision for a Sustainable Future." Now, I know this is quite a long title, but rest assured, I'll try to keep my presentation short. Thank you for inviting me to this wonderful conference. I also want to thank my reviewer, whose comments were immensely helpful in improving my paper, particularly in restructuring it and clarifying its main goals, as well as my definition of sustainability. The main goal of my paper was to examine the relationship between corruption and sustainability. Now, we all know what corruption is, but what exactly do we mean when we talk about sustainability? Sustainability is such a broad topic that I want to clarify what I mean by sustainability within the context of my paper. In my paper, I define sustainability as not just an environmental issue, but rather as the long-term maintenance of economic well-being. I also identify and analyze the effect of two key factors on economic sustainability. These factors are corruption and environmental performance. Additionally, I explore the role of emerging web resources, including social media, in combating corruption, promoting environmental performance, and disseminating a sustainable vision for the future. I identify corruption as a major impediment to the success of environmental performance and the overarching goal of economic well-being. The substantial focus of the paper lies in addressing corruption and how it impacts a nation's economic well-being. In the context of this paper, environmental performance refers to a nation's level of success in utilizing and adapting to environmentally sustainable practices. The focus of this paper is not on the environmental factor in and of itself, but rather the effect that a nation's environmental performance has on its economic well-being. To analyze the effect of corruption on economic well-being, I created the scatter diagram, Figure 1, of two variables, CPI and GDP per capita for the year 2010. I want to clarify right now that CPI stands for Corruption Perception Index, not Consumer Price Index. GDP per capita data was provided by the IMF. CPI was compiled by Transparency International, a nonpartisan global civil society. CPI is an aggregate of various factors indicating corruption, such as the extent to which a public employee can be held accountable for the use of funds. Nations are assessed according to these factors and assigned a CPI score ranging from 1 to 10, with a score of 1 representing a very high amount of corruption and a score of 10 representing a low amount of corruption. Therefore, nations with high CPI scores have low corruption, not high corruption. We can see an upward sloping trend in Figure 1, which indicates a positive correlation between CPI and GDP per capita. Generally, nations with high CPI scores, such as Switzerland and Denmark in this area, have higher GDP per capita. And conversely, nations with lower CPI scores have lower GDP per capita. Example would be Afghanistan, which is around this area. On the whole, nations with greater corruption have lower GDP per capita. So Figure 1's upward sloping trend suggests that corruption has a negative impact on economic well-being. Now, why is there this upward sloping trend? Well, corruption tampers with the nature of fair open market competition, reducing efficiency and thereby the quality of goods and services produced in a nation. Corruption also takes the form of the misappropriation of national revenue, through such it could be embezzled or used to pay off corrupt officials, among other misuses. And corruption has also been shown to discourage potential investors and to impede economic growth. In order to see whether the correlation between CPI and GDP per capita is a historical trend, I also created this scatter diagram, Figure 2, this time using data from the year 2000. Like Figure 1, Figure 2 presents a positive correlation between CPI and GDP per capita. As of now, I cannot say whether this is necessarily a causal relationship, because that would require more advanced statistical analysis, which I haven't learned yet. Also, the degree of correlation is still ambiguous because CPI, a nation's CPI score, can be influenced by culture or system-specific factors. And we should also note that the figures for GDP per capita do not take into account inflation within a nation or the differences in the cost of living between nations. Nevertheless, gathering from figures 1 and 2, it can be loosely stated that higher corruption generally correlates with lower economic well-being. Now, figure 3 is a scatter diagram of the two variables EPI and GDP per capita. EPI stands for Environmental Performance Index. EPI assesses nations based on 25 performance indicators in 10 policy categories, such as ecosystem vitality and environmental public health. Each country assessed is given a score ranging from 1 to 100, with 1 representing very poor environmental performance and 100 representing extremely good environmental performance. The upward sloping trend of Figure 3 suggests that nations that perform well environmentally, such as Switzerland and Iceland, that would be Switzerland, and Iceland is right here. Nations that perform well environmentally have greater economic well-being, and conversely, nations that perform poorly environmentally, such as Sierra Leone down here, tend to have lesser economic well-being. However, this is not necessarily a causal relationship. Again, more advanced statistical analysis would be required to determine that. I should also point out that there is a noticeable outlier from this trend right here, Qatar. As you all know, Qatar has the world's highest GDP per capita, but it only has a middle-level EPI score. Because there is no EPI for the year 2000, the historical trend in the relationship between EPI and GDP per capita cannot be presented. Generally, though, it can be stated that there is a positive correlation between a nation's EPI score and its GDP per capita. Figure 4 is a scatter diagram of the two variables CPI and EPI for the year 2010. The upward sloping trend shows that higher CPI scores tend to correlate with higher EPI scores. Once again, I'd like to point out that a high CPI score is an indication of low corruption, not high corruption. Therefore, lower corruption in a nation correlates with better environmental performance, and conversely, higher corruption in a nation tends to correlate with lower environmental performance. Examples of these countries would be New Zealand, around here, and Iraq, which is down here. Due to the fact that there is no EPI for the year 2000, this paper cannot present this historical trend in the relationship between CPI and EPI. Further study over time might reveal the intensity of the relationship between these two variables, but currently the analysis must be considered within the context of this limited available data. Nonetheless, it can be concluded that generally corruption tends to impede environmental performance. When explaining the upward sloping relationship of Figure 4, we should consider the trends previously established in this presentation, which suggests that poor nations are particularly susceptible to corruption and to poor environmental performance. To summarize the relationships I just discussed, there is a positive correlation between CPI and GDP per capita. There is a positive correlation between EPI and GDP per capita, and there is a positive correlation between CPI and EPI. Although further study is needed to assess the degree of these correlations, it can be said that generally, poor or developing nations are particularly susceptible to corruption and tend to perform worse environmentally. Now, this is not to say that wealthier nations do not have the same problems, but poor nations are especially affected by them. Consider the fact that many developing countries try to enhance their economic development at the expense of environmental considerations due to the cost or unavailability of clean technology, leading to the overexploitation of natural resources, among other environmental degradation. Also, developing nations can be breeding grounds for corruption because they lack sufficient regulatory systems, and citizens are not educated properly about their rights. For more detailed examples, please see my paper. Now, what can we do about corruption? Well, internet technology is transforming the way that ordinary citizens, including young people, can contribute to society by expanding our access to information and our ability to communicate. Online media culture has created an obsession among young people with documenting what they think, sharing their thoughts with their peers, and receiving feedback from their peers. Young people can utilize this passion for documentation and feedback to disseminate the vision of a sustainable future and to promote greater transparency. By posting about sustainability through social media, young people spread the message of responsible living and make it a cool topic for their followers. Sustainability-related topics trend or rise in popularity on social media platforms such as Twitter, which encourage sharing other people's posts. Social media users can receive feedback on their posts from followers and engage in dialogues sharing their ideas regarding sustainability. Young people can also utilize social media to reframe sustainability as a priority rather than a luxury. It is important that sustainability is framed as a matter of economic well-being, and a market-based approach can be far more effective in promoting sustainability than simply relying people to live green just for the sake of it. The government should take a market-based approach to sustainability policy and outline clear incentives for businesses that adapt environmentally sustainable practices. A market-based approach will reward businesses that invest more in sustainability, encourage competition, and lead to further clean technology innovation. The results will benefit consumers and the economy as a whole, in addition to the environment. Of course, there are dangers in reframing sustainability as a matter of economic importance and pushing this market-based approach so heavily. Although we'd like to believe that a free market economy is just fine on its own, some level of regulation is still required. We need checks and balances. Corruption will find ways to persist through the actions of influential corporations and unscrupulous lobbyists who may resort to bribery in order to avoid the costs of sustainability policies. So youth must take an active role in utilizing their considerable experience in navigating the web for a greater purpose. Both the private sector and the public sector must be monitored and held accountable for their actions, such as the transfer and the receipt of funds. Web-based resources are ideal for disseminating this information and making it accessible to the general public. For example, the Sunlight Foundation is a nonprofit, nonpartisan organization that maintains tools such as the Lobbyist Registration Tracker, which shows which U.S. special interest groups have hired new lobbyists within the past 45 days. this information is accessible to anyone with an internet connection. Another example of a web-based resource is BribeSpot, which is a smartphone application that utilizes geotagging, the technology behind the social media activity of checking in to a location via a mobile device. People can use the BribeSpot app as well as the BribeSpot website to view locations, to view and to report locations where bribery has taken place, as well as the size of the bribe and the area of government affected by the bribe. Now, there are still some questions about the accuracy and the safety of BribeSpot, but nevertheless, emerging web resources like BribeSpot are examples of the tools that young people can help create and endorse in an internet-based movement for increased transparency. It is crucial that technology be used in tandem with education. Unless young people are educated in how to utilize the vast amounts of information at their hands, increased transparency will be for nothing. Accountability is not a one-way street. Young people must embrace their responsibility to monitor and to contribute to society, and to utilize their access to information by participating in the political process. By educating young people in how to use technology, they can in turn educate their peers about sustainability, even on an international scale, through online communication. Education does not have to be restricted to the physical boundaries of the classroom. There are, however, limitations to technology because the citizens of impoverished nations may not have access to technology classes. Also, as previously discussed, impoverished nations are extremely susceptible to corruption, and statistical analysis conducted by the IMF shows that the more corruption, the less government spending goes into education. NGOs can play an extremely valuable role in making education and technology accessible to these nations and disseminating an accessible vision for a sustainable future. However, there are myriad NGOs that address overlapping or related issues, but operate separately from one another. Their efficiency can be increased by collaboration between them. For more details, please see my paper. A vision for a sustainable future encompasses not just environmental issues, but the long-term well-being of the economy and the integrity of the political system. In order to achieve this vision, we must create a culture of responsibility in which we account for corruption through improved transparency measures and include greater participation from citizens. Young people have the unique experience of being the most wired, most globally connected generation, and can utilize social media in fostering a culture of responsibility and in disseminating a vision for a sustainable future. Additionally, collaboration between sectors and between nations is essential in making innovations in information and technology accessible on a global scale. Likewise, through the international collaboration of various NGOs that promote education and technology, the youth of the world can unite in fulfilling a vision for a sustainable future. Together, education and technology can develop a sustainability-minded culture that is not tied to any one particular region or nationality, but rather whose influence and values are truly global. Thank you.
I feel like you're presenting totally new materials for the presentation, which was not really discussed in your original paper. So I feel like you're trying to make revisions on your paper to respond to the questions like concerns raised by the reviewers. So in that way, I think you've done an excellent job. And I guess the key message is to reframe sustainability as a notion of as a new notion of a new development. And Ms. Kim presented, put forward a new notion of sustainability by, in a way of reducing corruption, enhancing environmental performance, and promoting transparency and accountability. And this new notion of accountability can be disseminated through a social network supported by NGOs. So I think in a way she's bringing up a new dimension of social life, which is social capital or NGOs. So I think that's a unique aspect of the paper, which is not really discussed in other papers. And then, what other messages can be delivered or disseminated through social network? I think the other presenters would have some answers for that. One would be certainly medical sustainability that can be also disseminated through social network and through NGOs. So it's time to turn our attention to medical sustainability that will be discussed by Do-Il-hun, right, who will be presenting a paper titled Medical Sustainability, Why It Is Central, Critical for Our Future and What Needs to Be Done. Please welcome Mr. Do.
Before I start, can I ask, would I have 15 minutes or 20 minutes?
15 to 20 minutes, but I hope you can get it done in 15 minutes.
I'll try my best.
Thank you.
Right. Hello everyone, I'm Professor. And firstly, I'd like to thank the organizers and the supporters of this conference for giving the opportunity to stand here and speak on a topic that's very close to my heart, and one that I feel is very important for our future. As you all know, the topic of this conference is about sustainability, and I'd like to approach this from a slightly different angle, as mentioned. To give an outline of my presentation, firstly I'll try to put new meaning to the term medical sustainability, then explain why it is so critical for our future and why it is relevant to sustainability. Then I'll attempt to analyze why medicine has become so unaffordable and unsustainable. And lastly, I'll propose some ideas in order to remedy this. There are two events in the recent past that have led me to think about medical sustainability. The first is early last year when President Obama signed the healthcare bill, the full name of which is the Patient Protection and Affordable Healthcare Act. And this was the first attempt at providing universal healthcare to the whole American population. Then, less than a year later, Prime Minister David Cameron of the United Kingdom proposed the most radical overhaul of the NHS since its inception over 60 years ago. And something hit me about these two events, in that two of the leading societies of the world, arguably two of them, the United States and the United Kingdom, are both undergoing unprecedented changes in healthcare, even amidst massive controversy. And I propose that there is a more fundamental issue behind healthcare globally that we need to think about. So what is medical sustainability? If you do a Google search on this term, you don't really get many results. And the ones that do come up talk about the environmental effect of healthcare. And here I'd like to start from scratch and give a fresh definition that I hope you will agree with. So, to start off, sustainability in the dictionary is often quoted as the capacity to maintain, support, or endure. And in reference to the human impact, the impact of humanity on our environment, as mentioned before, the Brundtland Commission defined it as development that meets the needs of the present without compromising the ability of future generations to meet their needs. And I'd like to supplement this by referring to the Wikipedia and UN World Summit one, which goes, for humans, sustainability is the potential for long-term maintenance of well-being, which is environmental, economic, and social dimensions. One of the most fundamental needs of humanity is the need to be healthy. The possession of all the fortunes of the world would not carry any meaning without health. And so access to healthcare is an essential component of well-being. Thus, I propose that medical sustainability describes the ability of medical systems to provide adequate care to the present generation without sacrificing the needs and well-being of future generations. So why is medical sustainability critical for our future? Because it is healthcare around the world is failing on both of these counts. It is not providing adequate care to the now, nor is it leaving a sustainable legacy for the future. And underlying this phenomena is a universal observation that healthcare costs are rising uncontrollably. And this chart here on the left shows, as an example, the US healthcare spending as a proportion of GDP. You can see from 1960, where it was 5%, it has been rising constantly until 16% in 07, and indeed in 09, OECD gives 17% as healthcare expenditure. To put a number to this is approximately $2.5 trillion. And this may not mean much until we give it perspective. For example, this can be compared to the total US defense budget, which is only, well, I say only, $440 billion, and perhaps more relevant to this forum, $515 billion per year to shift the whole world, to solar power and other renewable energies. And to add insult to injury, $54 billion to feed every child in the world for a year. Compare that to the $2.5 trillion that is spent just in America, just on healthcare, and just in 1 year. Secondly, this is, I believe, the more worrying part, is that in spite of this increasing spending, access to healthcare is yet a disparate reality. In the US, which is a free market system run by private contractors, the top 5% of the US population accounts for 49% of healthcare expenditure. So just top 5% accounts for about $1.3 trillion. And on the other hand, the bottom half only accounts for 3%. So at least in America, the level of personal wealth discriminates access to healthcare. You may think that America is an extreme example, which it is, seen by the top line. But you can also see that most other OECD countries, in fact all of them, do exhibit rapidly increasing healthcare expenditure. And you may look at the purple line and think, oh, what is that country? What are they doing right? And that's in fact the UK, and the second lowest is Canada. And these are nationalized systems where the state runs healthcare. And because it can be regulated easily, healthcare expenditure can be limited effectively. However, these attempts have led to long waiting lists, reduced access to care, and reduced quality of care. And in 2005, the Supreme Court of Canada has given a verdict saying access to a waiting list is not access to healthcare. The Korean example is an interesting one, as it is a hybrid between the nationalized and the private market one. It uses about 6.5% of GDP compared to over 10 in Europe and almost 20 in America. And most of you may know that it does provide good, affordable access to healthcare. But the problems begin when we encounter serious illnesses such as cancer or other chronic diseases, when there is a massive personal financial burden, often leading to family bankruptcy, as the health insurance in Korea only covers on average 50% of healthcare charges. And another result of limited healthcare expenditure is the sacrifice in quality of care, often called the Korean 5-minute diagnosis. And the fundamental issue underlying, again, these two factors is that overwhelming healthcare spending sacrifices the needs and well-being of future generations. In this year, the global population hit 7 billion, I think, and populations around the world are aging more and more. As you can see, this chart shows that in 1960, there was a 5-to-1 ratio between worker and the beneficiary, which reduced 3-to-1 and is constantly going down. And the vast majority of healthcare spending is for the 50-plus age group. It is the spending for the now, for the leaving generation. This is a chart taken from Bill Gates' talk on state budgets at TED. And this shows the US spending as a proportion of their GDP, divided into federal, state, and local levels. In America, most healthcare expenditure is burdened by the individual. However, even so, there is massive spending due to Medicaid and Medicare from the US government and the state, which funds healthcare for the aged, the veterans, and also disabilities, etc. And this is complexly split between these three levels. And this, as an example, is the California state budget. And in 2010, 26% of the budget was spent on healthcare. This is predicted to rise to 42% by 2040. Considering that the income of the state and the overall income of the whole government is constant to a certain extent, something must give to account for this difference. And to directly quote Bill Gates, in order to accommodate that, you'd have to cut education spending in half. That's laying off teachers, increasing class sizes, cutting funding for higher education. It really is this young versus the old. And here, to illustrate this point further, I'd like to refer you to this pie chart of US federal spending. And you can see Medicare, and Medicaid in red. And as that increases, as it eats away more of the pie, if you like, as GDP, as if you think GDP as a proportion, it can never increase beyond 100. as it eats away more of the pie, something must give. Defense spending is usually spared due to the recent terrorism threats and also the for the America's role in the global stage. And what we'll give is spending on social security and other discretionary spending. That includes things, of course, education, spending on infrastructure, urban development, agriculture, research and design, etc. That are so important for the needs and well-being of future society. And to do simple maths, this is the total income of the federal government last year, just over 2 billion. And comparing that to 3.5 spent every year by the government, that leads over $1 trillion deficit every single year that is building up. And something, again, must give. And to quote David Walker, the previous US Comptroller General, he's the head accountant of the United States, what's going on right now is we're spending more money than we can make, we're charging it to a credit card and expecting our grandchildren to pay for it. And that's absolutely outrageous, and that's not my vision for a sustainable future. So, why has medicine become so unaffordable? And to explain this, I'd like to propose to think of healthcare as one big service, one big corporation, if you like. And forgive me if I simplify things too much, as my expertise in economics is relatively shallow, but I just want to illustrate the principles. And I would like to propose that two factors determine healthcare costs. One is the supply-demand ratio, and second is operating expense of healthcare. And firstly, the demand for healthcare far outstrips the supply. Health is a shared need by the whole of humanity. And thus the potential demand for healthcare is pretty much infinite, 7 billion if you like. And as populations age, immediate urgent demand also increases greatly. However, healthcare is a very specialized industry, and supply is also very limited. And this poor supply-demand ratio massively increases cost. And no need to say that supply of healthcare is virtually non-existent in developing countries. Secondly, operating expenses of healthcare are incredibly high. Physicians are highly qualified, on average more than 12 years of training, and this cost must be recuperated through high physician charges. Moreover, medical innovation is incredibly expensive, but so far has not really led to significant cost savings. And likewise, pharmaceutical industry is difficult to assess and regulate due to market forces and political barriers. And fundamentally, the problem is that healthcare delivery systems are severely outdated. The business models of the general hospital and the physician practice that we use today were designed over 100 years ago. And it has stagnated and has failed to evolve with the times. And medicine is changing a lot, from intuition to precision. Previously, we relied more on the problem-solving ability of doctors and their experience, whilst now we have more genetic, precise diagnostic mechanisms and treatment. For example, using scanners, using genetic tests, using blood tests. Now it is a more precise affair. Moreover, due to the development of vaccines and antibiotics, we have less acute disease to deal with, such as infections, and more chronic diseases, such as cancer, diabetes, and heart disease, which patients suffer for years and years, usually until death. So how can medicine become more sustainable? I'll propose some ideas. Firstly, we need novel business models of healthcare delivery. I propose that we need more specialist centers and allow doctors to undergo less training and specialize earlier. This will cut down on the expensive and often unnecessary medical training, hence lowering physician fees and hence lowering the operating cost of healthcare. Moreover, this will increase the supply of cheaper healthcare, hence helping to balance out the supply-demand ratio. And it is hoped that specialism, much like in a specialized factory line, will allow care to be delivered more efficiently, of a better quality, and thus more affordably and accessibly. The diagram on the left here shows the traditional system, where we have just the clinic and the hospital, and it works in a linear fashion. This leads to pooling of patients and no flexibility in no flexibility for the care delivery to match the nature of the different conditions that patients suffer. On the right, however, is a very simple diagram how it could work, and specialist centers could specialize for different diseases, hence giving more supply, giving more choice, and hopefully efficiency. And chronic disease centers is an example of this. And so far, all medical care is given for a fee-for-service arrangement. A patient goes to the hospital or uses a clinic, and they pay for the service they receive. However, this is incredibly inefficient for chronic diseases, where patients have to go to the clinic week in or month in, month out for years and years until death, for decades. And it increases the cost of healthcare incredibly. On the other hand, I propose that we can have a membership model, for example, where a specialist center provides specialist care to a certain disease, for example, a diabetes center. And the total cost burden of that center could be split by the number of patients and hopefully, and hence accommodate more patients at a cheaper cost whilst fulfilling demand and increasing supply. Moreover, bringing patients of a certain disease together will allow them and their families to provide moral support and more information to each other. I propose that a redefinition of health and healthcare needs to go hand in hand with this change. And contrary to popular belief, health and illness are not separate states. Health is a continuous spectrum. As early as 1948, the World Health Organization defined health to be a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so we need to propagate the idea that healthcare does not treat illness, but rather manages health. And for example, health management services could start a revolution in preventative medicine. And related to that, I believe IT is critical for delivering future healthcare and the management of health. IT advancements are the only way that we can create the infinite supply, well, supposedly infinite, to match the infinite demand. And it will allow the public to truly manage their own health and allow the era of truly personalized medicine, which has been used as a coin word, catchphrase for a long time. Moreover, IT can enable clinics to work more efficiently and provide a higher quality of care. And as a simple example, I show you an image of a current blood test report that's utilized in most of the world, or in a similar fashion. And this is boring, doesn't provide much information, it's very hard to understand for the patient, and it is doctor-oriented. It is made for the doctor. For example, this is what it could look like. This is a blood test report for the patient. It is put in a much more intuitive fashion, it is much more accessible, it provides much more information relating to the patient's health and how certain numbers, how they actually affect the patient's life. And we can clearly envisage a world where such blood test results could come to our smartphones, could come to our tablets, to the personal computer, and perhaps even we could link certain numbers or certain parts to more information that would be relevant. So I propose that IT is important in bringing healthcare out of the hands of the doctor and into the hands of the public. So my conclusions, and it is a plea for help to the young generation. To summarize, healthcare has become incredibly expensive, and yet when the dilemma is between spending more and losing lives, there can be no choice but to spend. Modern medicine, however, is not even providing adequate care to the current generation, let alone the massive social impact of overwhelming healthcare spending. Simply put, medicine is not sustainable, and something needs to be done to avoid a humanitarian crisis, which arguably is already happening in the developing countries. So I propose that a complete interdisciplinary effort is critical for any progress. What the sick healthcare systems of the world need are not just doctors. Rather, we need economists to develop market models. We need entrepreneurs for medical innovation and business model innovation. We need politicians to implement policy changes that will aid the revolution in healthcare. And the list goes on and on and on. And I'd like to finish by referring to some of the social innovations and industry innovations that we have all experienced ourselves. And that is, for example, the automobile industry and the flight industry, where in the early days, only the super rich could afford to use cars and to fly. But there came a tipping point, and for example, that could be the mass production line of Francis Ford, where it allowed all of the public, now we can all use cars and fly. And an example is the personal computer revolution, where in the beginning, only a select few institutions could own computers, and only extremely highly qualified individuals could run them. But again, there was a tipping point, for example, the development of the microprocessor, and that brought personal computers into our hands, into our living rooms, into our pockets. And so I propose that, I urge you to, I hope I've persuaded you of the importance of medical sustainability. And with a combined effort, I believe that we can bring healthcare, which is currently very expensive and unsustainable, into the hands of the people to create a sustainable future. So I sincerely hope that this discussion of medical sustainability is a significant first step in fulfilling this vision of a sustainable future. Thank you.
Well, when I said that you've got 15 minutes, I didn't mean to like force you to speak very, very fast. But I think you've done a great job in talking about what we mean by medical sustainability and ways in which we can improve on the current system of healthcare and how to deliver the healthcare. I was curious about your idea about the specialist centers, and it was not clearly presented in your paper, but in your presentation, you made a much better job in clarifying what would be the roles of specialist centers in terms of reforming current system of healthcare. We've got a third paper ready for presentation. Presenter is Sojin Lee from Mauntholyoke College, who will be presenting the paper titled "In Face of Public Debt, Buildups: Is social spending sustainable in the long run?" I think everyone might be curious about the rising cost of social spending these days. You might be curious about whether or not social spending contributes to debts of a country, and her answer is yes and no. So we want to hear from her why she thinks that the answer is yes and no, meaning that social spending might contribute to country's debts, but it wouldn't be, it wouldn't work in the same way unless you take into account the kinds of social spending with in great debt.
Yep.
Okay, it's time for Ms. Lee Sojin. Please welcome Ms. Lee.
Thank you, Professor Gu. Good afternoon, everyone. My name is Sojin Lee, and I'm a rising junior at Mauntholyoke College. I know that you've all been waiting for me to present, as I'm the last presenter of the conference today. But unfortunately, I have that much of a burden to, present as well as my predecessors did. Nevertheless, we shall begin. My paper concerns the sustainability of government's welfare spending to social programs such as pensions for the elderly, publicly funded daycare services for the infants and toddlers, unemployment benefits to the unemployed workers and the injured, parental leave compensation, supported employment and rehabilitation services, all in the face of growing levels of public debt today in advanced economies. And so the title of my paper is "In Face of Public Debt Buildups: Is Social Spending Sustainable in the Long Run?" Okay, so before I begin with anything, I just want to define what I mean by sustainability throughout my paper. By sustainability, I'm not talking about the traditional green or environmental sustainability that we heard about in session 1, but rather something that's long-term, permanent, robust, and healthy. Nowadays, the growth of central government debt as percentage of GDP is the trend in many of the advanced OECD countries. If you look at this table here, compare the figures in the leftmost columns, which is the level of GDP in the year 1980, to the rightmost columns over there, which is the level of GDP just the last year. The countries highlighted in red are those countries receiving high news coverage and media attention due to their high public debt growth rates these days. If you look at Ireland, UK, and the US, their level of public debt has doubled and even tripled within the last 5 years. And in the case for Greece, Italy, and Japan, their amounts of public debt grew even larger than their GDP. Even our country, Korea, seems to be following the upward trend. So by now you may be asking, why is growing levels of public debt unsustainable in the long run? Well, I propose that there are 3 main reasons. The first being increasing levels of public debt raises the long-term interest rate, which would obviously discourage people from long-term investment and growth. So with high levels of public debt, we don't have continuous economic growth, and growth thus becomes unsustainable. The second reason is, the second issue at stake is something like whether countries like Greece will be able to pay back its debt. If Greece officially says that the government cannot pay back, the countries who invested in Greece and the people who lent their money to Greece will immediately start withdrawing their money. Then a financial panic, a crisis may occur. Hence, the steady, stable financial state becomes unsustainable. The third reason why the growing levels of public debt is unsustainable is that in the countries like the US, if the countries like the US is sustainable is that public debt buildups in countries like the US threatens the entire global financial structure. If the US government becomes bankrupt, then people may find fault with the current global financial system, and especially with the IMF based in the US and practicing lax policies towards the US. If countries in the European periphery become bankrupt, then the common system practiced by the EU may be altered. Hence, the whole international financial system is unsustainable. The conventional understanding of why public debt is building up and consequently is leading us to an unsustainable future is that as the composition of government expenditures changed from purchases of goods and services to social spending, social program spending, the level of public debt started to increase in the advanced OECD countries. Indeed, today, it seems to be the case that public debt is piling up in wealthy countries where there is extensive welfare programs, whereas the level of public debt is not on the rise in the not so wealthy emerging countries where there is scanty or no welfare programs. So how exactly does social spending increase the public sector debt? One mechanism has a productivity aspect, in which social spending has no productive aspect because it's not productive in the economical sense, and it only uses up scarce government resources, and so it is bound to the fate of public debt buildup and is unsustainable. The second mechanism deals with the commitment aspect, and social spending is more difficult to cut than the traditional government purchases of goods, because it is like a contract between the government and the people for public provision of social protection. Again, as it is hard to cut, it is bound to the fate of public debt buildup and is thus unsustainable. So the conventional understanding by political economists starting in the late 80s and early 90s was that government spending on social programs only increases the level of public debt and is thus unsustainable in the future. However, in my paper, I raise the question, does government spending throughout all social policies necessarily lead to public debt buildups? My intuition was that while it makes sense that spending on pensions and unemployment benefits, it will increase levels of public debt, but it's not so clear why spending on programs that support the employed should increase levels of public debt. Think about it. The rest of my presentation is as follows. I will clearly state my hypothesis, tell you the methodology and data I use to test my hypothesis, share my findings, and conclude. I first make a crucial distinction amongst amongst the main social programs. One group is targeted to the unemployed, and the other group is targeted to the employed. The first group to your left contains pensions and unemployment benefits, and the second group to your right contains family allowances and active labor market policies. Family allowances mean parental leave compensations, daycare services, and straight redistribution to families in poverty. The population who benefit from active labor market policies is kind of mixed because the policy can sometimes support the employed, and it can also sometimes provide new startup incentives and employment incentives to the unemployed. I omitted the health and housing aspect of welfare as it is unclear which category it would fit into because it's not clear-cut. So my hypothesis is that government spending on social programs targeted to the unemployed leads to high levels of public debt and is thus unsustainable in the long run. In contrast, government spending on social programs targeted to the employed does not lead to high levels of public debt and is thus sustainable in the long run. The reasoning behind such different impacts on levels of public debt is that while social programs targeted to the unemployed redistribute to those who are not economically productive, social programs targeted to the employed redistribute to those who are in the workforce and are thus productive. Whereas the old age and the unemployed populations would not have the incentives to become productive and would rely more heavily on the government, the employed workers would secure their jobs and remain productive, being able to pursue various services on their own and rely less on the government. I employ statistical analysis to test my hypothesis. I have two sets of data at the country level, which I gathered directly from the OECD statistics portal. I have cross-country data and panel data, which has a cross-country and over time dimensions. For the first statistical model, I employ the standard multivariate OLS regression using the cross-country data for 29 OECD countries at year 2007, which was the latest data for cross-country levels of social expenditures available on the OECD statistics portal. I have 29 OECD countries because 4 countries joined in 2010, and Turkey does not have sufficient amount of data that goes back all the way to 2000 and 2010, which I'll be talking about later. In simple terms, I can control for everything that can possibly impact the level of public debt in a country, such as tax rate, the total government spending, GDP per capita, current accounts, unemployment and inflation rates, and the population growth rates. Controlling for all these variables, I'm looking at whether higher social spending causes higher levels of public debt. Because I'm looking at spending on programs targeted to the unemployed and that are targeted to the employed, I'm expecting that the coefficient in front of the spending variable should be different. The sign in front of beta 1 should be positive, saying that spending on programs targeted to the unemployed raise the public debt, whereas the sign in front of beta 2 should be not positive, meaning that spending on programs targeted to the employed do not raise public debt. To ensure that this causal effect holds over time, I use a panel regression, otherwise called the country fixed and time fixed effects model. In this model, I control for the same variables, but I further control for omitted variables that are constant over time but vary cross-country, such as different attitudes towards social policies, and other omitted variables that are constant across countries but vary over time, such as international standard and norms on redistribution. You can see these new variables are called AI and BT. I use a panel data for the same number of OECD countries for the years 2000 to 2007. The year 2000 was the furthest I could go back for many of my variables in my sample countries. But also the biggest trends in the rise of public debt have been occurring in the last decade, so it's a very nice time frame. Again, controlling for control variables, country fixed and time fixed effects, the coefficients of beta 1 and beta 2 should have different signs. Beta 1 should be positive, and we shall see about beta 2 now. This is the regression results for my first multivariate OLS regression. Focus on the first row here, please. The signs in front of pensions and unemployment benefits are positive, whereas the signs in front of family allowances and active labor market policies are negative. But only the coefficients on the first row and the third row are statistically significant. And you should also notice here that the R squared are very strong as well. My findings suggest that while spending on pensions increase public debt, spending on family allowances actually decrease the levels of public debt, hence the positive and negative signs and statistically significant numbers. This is the regression results for my second panel regression. And again, please focus on the first row. The statistically significant numbers in the first and third columns again have different signs. Old age pension has a positive sign, whereas family allowances have a negative sign. This shows that while spending on pensions increase the level of public debt, spending on family allowances actually decrease the level of public debt. findings summarized in both tables are in support of my hypothesis. I do robustness checks on several grounds. The main one is that I break down the active labor market policy further into smaller spending areas, supported employment, and employment incentives. While it's clear that supported employment is targeted to those already in employment, it's not so clear about employment incentives as it could target both the employed and unemployed. The effects of spending on each of the smaller spending areas are different, and I found that spending on supported employment, already targeted to those already employed, actually decreased the level of public sector debt, as you can tell by the negative sign here. Hence, my overall conclusion is as follows. It is found that government spending on social programs targeted to the unemployed contribute positively to the levels of public debt and is thus unsustainable in the long run. However, contrary to the conventional belief, government spending on social programs targeted to the employed actually reduce the levels of public debt and is thus sustainable in the long run. Policy implication is that level of government spending on social programs targeted to the unemployed, if it's too high, then the central government should seriously consider cutting it, even if there may be political costs. As it is found in this paper, social spending on pensions and unemployment benefits only increase the levels of public debt and are unsustainable. On the other hand, if the level of government spending on social programs targeted to the employed is too low, then the central government should continue to spend or even increase its support on programs targeted to the employed, as such government spending is sustainable in the long run. That was the end of my presentation and also the end of all presentations today. I apologize for the number-dense presentation. As a math major, I naturally focus more on the statistical analyses of my paper. I thank EAI for this opportunity to present my paper, but not only present my paper, I was able to really learn, get together with intellectual women and men coming from diverse academic backgrounds and interests. So I was able to learn a lot more than I bargained for today. I look forward to your valuable comments and criticisms, and thank you for listening.
As I said, I'm going to give you 5 minutes in sharp, so that we can spend about half an hour in order to devote more time to the group discussion. So please mark your time. Otherwise, I would I don't know what to do, but something like a punishment will be waiting for you if you don't mark your time. Okay, let's begin with Eugene Lee, who will be talking about the paper by Do-il-hun.
I enjoyed reading your paper very much with the new term medical sustainability, and throughout your paper it was very clear and concise, and you gave a nice solution to the problem that you stated. Just as a suggestion, maybe you can include a detailed case study of some of the new models of medical delivery. And yeah, as a suggestion, there's a eye care clinic in India that started a few years ago. I can't remember the name exactly, but it started as a non-profit organization, and now it grew to be like all over India. And the cost was cheap. It was easily accessible, and it had a very efficient delivery system. And with the IT uses, the doctors communicated with their patients through like programs like Skype, so that they don't have to go to the hospital, or it was very efficient. They could meet a lot of patients, and it's still personalized, I think. So if you include a real life case study and the success of it, that would further back up your arguments in your paper.
No, you've used only 1 minute.
There's 2 minutes.
That's it?
Yeah.
Because she has not used the time designated for her. Let me elaborate a little bit more on the issue that just came up. Well, I thought that
you must have discussed like HMO, Health Maintenance Organization, which was imagined as a solution to the rising cost of healthcare in the United States. And not only the cases, successful cases, they would support your argument, but you might have looked into, the cases that were really experienced in the real life, especially in the United States. HMO was thought of as an alternative to the current system. So you might want to elaborate on what has been tried in terms of dealing with the rising cost of healthcare in different parts of the world. Okay, Sumin Song.
Reading your paper and listening to your presentation was a good opportunity for me. IR students like me really don't have a chance to know such like medical information. It's really hard to reach. There is something that I want to point out about your paper. Your paper included explanation, comparison, and criticism about the current healthcare system. I think that's enough to help the audience to understand what kind of the healthcare system exists today. But I think there should be more about the positive influence or the vision of the newly changed healthcare system will bring about to the society, since the topic of the conference is sustainable development, not the sustainability itself.
Okay, good. The audience should be nervous. Like, much more time will be waiting for you. So more opportunity for the audience. Okay. Well, if there is somebody, in this floor who want to add something to the questions that came up, because I want to make sure that we want to address issues that need to be dealt with by the presenter regarding your own works. Any persons, any people who want to add more to this question?
Thank you. I just wanted to say I really enjoyed your presentation. I didn't have a chance to actually go every single word of your paper, but it seemed very interesting. At first I thought it was about medicine, and medicine as in something I take when I'm sick. So that's how shallow my knowledge is in this field. But it was very clear when you described the definition of what you think as medical sustainability means by using the pre-existing definition of what sustainable development is. So I really enjoyed that. I just wanted to make just one short comment about one of your possible solutions as to promote having more specialized centers than the current system, which is more of a linear structure. I was very interested in that. I think it's very feasible to have that system in place, and also actually lowering the training period of doctors. But then again, I do have one concern, which is that then what would happen to certain fields that does not have the enough demand? For instance, like cardiosurgeries. I don't know, I've heard some stories, and these are very essential medical services, but which does not really occur frequently enough for these physicians in that field to actually conduct the practice field. So I just wanted to hear what you think about that. Thank you.
I have some issues with your suggestion that training should be reduced, which I think is extremely dangerous. I may be persuaded by your arguments that there is merit in reducing training, but with everything in life, you've got to balance different interests. Yes, reducing training might provide a greater supply of doctors and medical services, but we've got to weigh that against the interests of patients. The risk of harm to patients is greater with less training for doctors. And if you balance it up, I would say that the interests of patients should prevail. And my second point is that I have doubts as to whether the membership model that you presented would work. And I think more studies should be carried out in that regard. but I think as a matter of fairness, I don't see why a member who is perfectly healthy should be paying for another member who is ill and is spending more money than he has paid. Surely it is fair to pay for the services you've received. I don't see any fairness in that model.
As all the other discussants mentioned, that I also did enjoy your presentation and very much. But maybe I missed a part of your presentation because you speed up too much, or maybe you didn't mention at all. My question is, it is true that the issue of the health is universally very much important, but it became a lot more dire in the situation of developing countries. But do you think what you suggested could be working very well in the developing countries, and how are they going to institutionalize in those impoverished economies? Thank you.
Thank you very much for your presentation. I truly enjoyed it. And also, I was very intrigued about the specialty center that you proposed. Rather than manufacturing system, have a more specialized treatment for each patient. But my concern is that a disease is more of a holistic and comprehensive one. For example, a cancer patient is not only, it's not the cancer itself is the problem, but also the byproduct of such cancer is a problem for the patient. So one of the rising concerns for the specialty center would be that if there is only cancer center and the doctors are not specialized on anything other than cancer, then this byproduct of disease would not be treated. So I would like to ask what would be the measures that can be taken in the specialty center. Thank you.
And you might want to talk about whether or not the model you proposed can be, applied to the Korean society. Yeah. Okay. And whether, to what extent, your model, the model you proposed, can be applied to different parts of the world. Whether it is confined to the countries with, single-payer system or, other kinds of delivery systems. So I think people might be curious about how much we can learn from your model as people who live in Korea. Okay. And you've got about 5 minutes to respond to the questions that came up. Maybe more than that, a little bit.
Right, thank you for all your questions. And actually, I'm very happy that all those questions came up, because I could talk for hours on each of these points. And I think one of the issues was that in order to try and keep everything in time, I did reduce everything down to the basic skeleton. So to first go for Ms. Lee's question, oh no, not question, sorry. Okay, right. Actually, I'll combine things. To first talk about Prof's suggestion of talking about the health HMOs. I think they're health management organizations. So in a way, these were actually implemented, I think, in the 70s, so decades ago. And the aim of HMOs, health management, is very similar to what I'm proposing now. And I acknowledge this. However, in actuality, they did not lead to cost savings as healthcare overall. And the reason for this goes, again, back to the model of business models, that even HMOs could only run through hospitals and clinics. They were the only two delivery systems that HMOs could use to deliver care. And that, again, leads to the same fundamental problems of healthcare. Secondly, to talk about, a lot of you mentioned specialist centers. And firstly, to answer Mr. Ryu's question about what would happen to about the Korean medical system, where many doctors avoid, actually many medical students avoid the essential fields that, for example, heart surgery or neuroscience, etc. And I would propose that this is only so extreme in Korea. For example, heart surgery, which is the least subscribed field in Korea, is the most subscribed field in the United Kingdom. And you have to be top of the cream of the crop to be able to go into that field. And the reason that in Korea people have begun to avoid these fields is that, firstly, Korean doctors are made to work incredibly hard with no sleep for years and years and years. And so they avoid the fields that are physically demanding, and I understand why they do that. And secondly, in Korea, the reason that healthcare costs can be limited so strongly is because the government sets the limit of how much you can charge. For example, government says that a heart doctor cannot charge more than a certain amount. However, these limits do not apply to fields such as cosmetic surgery, to dermatology, etc., which are very popular, because physicians then can charge as much as they want and become rich. And that's the reason why in Korea, many doctors and medical students avoid the essential fields. I think it was Philip who talked about the dangers of lower training. And I would like to clarify that what I mean is not to lower the training of all doctors. And what I mean by specialist centers is to increase the variety of healthcare delivery systems. And as you saw in my diagram, my new model still has a general hospital, because general hospitals are incredibly effective at diagnosing complex diseases, which are interdisciplinary in nature, and treating those. For example, often we cannot understand, even yet, we don't understand what disease a patient has or how to even go about treating it. And in that case, they do need a general hospital where many different doctors of different specialisms can contribute to one patient. However, there are other cases. For example, I propose spinal disc surgery, where it is a set technical procedure. They often say that doctors in those fields can be thought of as engineers or actually a specific service provider. And in those cases, you can reduce the level of training. And this is already beginning to appear in America, where there are, for example, orthopedic surgeons who do not undergo the 12 years of training, and they only do, for example, 6 or 8, and they're more like technicians as opposed to doctors. But the irony is that the medical results from these clinics are far superior to even the best hospitals in America. They provide better results than Harvard Med or any other Johns Hopkins, etc. So less training does not necessarily lead to downgrading of quality of care, as continuous practice of a certain technique usually leads to better results.
These are not non-specialist centers. These are specialist centers.
Yeah. So we will still have other primary care clinics, which we will go for. We will go to for them to locate, send us to whatever we need. And again, the membership model, I agree with you that we need a lot of study on this, because it's a very new idea. It hasn't been implemented as yet. But I know there is a system called General Doctor in Korea. This is at Hongdae, if you're interested. And these guys actually have a new way of giving care, in that they give 30-minute slots for every patient. That's their rule. They give 30-minute slots. And what they do is they have a member group of patients. So you pay a certain fee a year to be a member of this general doctor surgery, and they actually can take care or manage your health more effectively. So that's an example of what's already been done. And in terms of how specialist centers would provide a holistic approach, by specialist center I don't mean that currently, for example, in Korea you have many different specialist clinics, and they're not holistic because they focus on a very small aspect of medicine. But what I mean by specialist centers is, for example, a disease base. For example, a diabetes clinic. A diabetes clinic would have doctors who, for example, diabetes involves doctors related to blood, also to hormones in the body, and also to, for example, orthopedics and other treatments. And I propose that a single specialist center would contain different doctors of different specialties, but who focus on treating diabetic patients as a whole. So that these specialist centers will provide a holistic approach for each disease. And of course, in the cases where people have several different diseases, then they would go to a general hospital to be treated. So I'm just proposing that by increasing the variety and increasing the different mechanisms that we can use to deliver care, then we can deliver more accurate care, more precise care to each patient, and hence create a system that is more patient-centered as opposed to the doctor-centered system now. Right, and developing countries, I realize that I have hardly touched at all in developing countries, because in developing countries the medical problem is nothing to do with medicine, frankly. It's more of a social problem, and it is interesting that most medical advancements that we have seen so far have not actually led to a significant increase in life expectancy. The biggest factors that influence life expectancy of a population are social and political policies. So it's kind of counterintuitive, because you may think better doctors and better healthcare leads to a much greater life expectancy, but rather it's social policies on things like hygiene or accessibility to primary care or accessibility to vaccines. And so unfortunately, I would have to say that social changes are the necessary part for developing countries. Perhaps IT has a role in that we may be able to, computers are easier to send out to remote parts of the world potentially than doctors. And in the real world, most doctors aren't willing to sacrifice a high pay or a good quality of life to go into the remote parts of the world. And there are not even secure facilities to deliver care. And so that's why I call it a humanitarian crisis in developing countries. Right, thank you.
Let's say lessons for the Korean society for the later discussion. All right, it's time to turn our attention to Carol Kim's paper on how to reframe the notion of sustainability. We've got two discussants, Yoon-Seok Chung and So-Min Kim. Let's begin with Mr. Chung.
I really enjoyed your paper. Your paper puts together a lot of different topics that are very intellectually stimulating. And having corruption, environmental performance, economic sustainability, and social network in your title suggests that you do have a very ambitious agenda in mind. And actually that was one of my most pressing points, because you do spend about almost a page explaining your agenda of looking at different variables concerning sustainability and moving on to social networking and SNS and also NGOs, education. So I think it might be better to have this kind of a more overarching question that kind of can run through what you're trying to do. And I was trying to figure what that kind of question would be. And you do seem to start with this definition of economic sustainability as a long-term well-being, long-term economic performance. And on that point, you choose to use GDP measures to kind of indicate that kind of long-term performance. And I think that was one of the first questions that just came up in my mind. If you are defining sustainability as a long-term thing, then how can you just look at GDP that only includes specific factors? And GDP as an indicator has been coming under various attacks for its deficiencies. So I think, and it's true that there are not that many substitutes either. It's a problem for a lot of social scientists too. But anyway, yeah, the choice of using that variable was my first point. And the second one is the correlation between environmental performance and GDP. And I think most literature so far suggests that the causation goes from GDP to environmental performance. Countries with more resources, more developed economies can devote that much more attention to improving the environment. So whereas your paper first seemed to suggest that environmental performance and corruption are both factors of economic well-being, some people could argue that economic well-being is actually a variable that goes into environmental performance. So I think those two were the main points that I had for the first part of your paper. And actually, I took more interest in your correlation between EPI and CPI. And I think more kind of literature reviewed have revealed some more enlightening aspects about this and how corruption, environmental performance are related. And I think I can see a way of finding various mechanisms that can explain this trend. And so far, I think you have just run different scatter plot diagrams and try to find a trend. And having this kind of mechanism to explain those trends, I think, are much more important in terms of presenting your argument to the audience. And then you go on to the role of SNS NGOs. And I think it is really true that there are different ways of promoting environmental performance sustainability other than some kind of top-down approach. And actually, one of the topics that we're considering for the next year's conference directly relates to this area. But at the same time, it's true that because this is a very fad-like topic, you need to qualify it much more and ask questions about, what kind of SNS approaches, what kind of NGOs are really successful. And it is true that there are a lot of organizations, a lot of networks and a lot of sites that do this work, but there are only a select few that really get everyone's attention and kind of form this informational cascade that runs through the society. So one possible approach might have been to actually just focus on one aspect of the NGO or one slice of the SNS and explain how effective these organizations or network sites they can be, how effective they can be if they have tried these different methods. So I mean, kind of not rather than kind of searching for different NGOs that focus on this area, searching for ways that they can be really successful and effective in terms of promoting more consciousness, awareness, and a better understanding of what sustainability really is. And I think your paper does bring up a lot of points that are very interesting, and I think you can pursue a lot of these different strands and turn them into really good papers. So, I mean, for example, like the problem of lack of funds and how that problem which is really, really important in terms of developing countries. If they're trying to promote their environment or sustainability, how are they going to go about that if they don't have that many funds? You could really look into this topic and just delve in. So, I guess to go back to my first, comment, to have this kind of overarching question that you are, trying to answer and working through that, I think, would turn your paper even greater. So, thank you.
Thank you. So you sound like a professional discussion. Oh my God. I'm really sympathetic with many of the comments you made. I was about to make the same comments. All right, anyways, Sung, next.
Thank you, Ms. Kim, for your wonderful presentation. I think your paper has great potential with many interesting ideas. But the first problem is that you have too many ideas in this short paper. And the second problem is that they are ideas, not actually a causal explanations. So the first step in revising your paper should be to choose one or two issues that you're really interested in, as Mr. Chung said. You could study the impact of corruption on environmental performance, or you could study the impact of NGOs on the environmental performance, exploring what kinds of strategies are effective in enhancing the environmental performance. Social media could be an interesting topic, but the access to social media is easier in more developed countries, and these countries, as you said, are less corrupted and already more environment friendly. So I have some doubt how social media can play a significant role in lowering the corruption or enhancing the environmental performance. And you could study the impact of corruption on economic well-being, but I think this topic is already overstudied. So I suggest you to focus on the former two things I've mentioned. And the second step is to present causal mechanism rather than spending your time or space on describing data. Without an advanced statistical analysis, you can convince the reader if you provide convincing logic, which is missing in this paper. For example, say you choose to study the impact of corruption onto environment. Then you should tell us why corruption leads to the lower environmental sustainability. It could be the economic logic. Maybe economic well-being could be an intervening variable leading from corruption to environmental performance. Corruption leads to less economic development, and these countries are not offered to enhance their environmental performance. Or there could be another logic independent of economic mechanism, like if the corrupted countries have like bad bureaucracies and they cannot implement effective policy making, and this could be one possible mechanism you can explore in the future. I think if you take these two steps, your paper will turn out to be really great, I believe. Thank you.
But Seon, you would agree with me that she is a great writer. I mean, I was really impressed by the quality of your writing. It was really intense. It's one of the best writings I've ever seen. So that's something she's got as her really potential ability. But the paper can be more better organized, as suggested by two other discussants. Any other questions? Like one or two more?
My question will be a bit complementary with the other questions that you have got so far. You said that the corruption could be eradicated in a way to take advantage of the role of the internet system, communication among the public, and the role of the NGOs. But I feel like countries where the corruption is prevalent, they do have some government issue that, like for example, China is in itself suppressing these kinds of movements like internet system and the communication among the public. So I feel like this is a quite vicious cycle. And how are you going to break that vicious cycle?
Okay, I thought we're supposed to finish by 6, but I'm looking at the program one more time, realizing that we need to get it done by 5:30. Is that right? But given that we started a bit late, can we have like 15 more minutes? Okay. Thank you. Thank you.
Thank you very much for your comments and your questions. You are correct in saying that I have quite a few ideas in my paper and not really enough explanation of the causal relationships. I have to be honest and admit that I don't have much experience with statistical analysis. I'm going to be beginning my freshman year of college this fall, so the most advanced math I've taken is AB calculus in high school. But when I do study more advanced statistical analysis, I'll definitely try to apply it in these areas that are of interest to me. As you pointed out, my paper already has so many ideas, but if you can believe it, my first draft was even more bloated. As Professor Koo pointed out numerous times in his comments, my paper had some issues with structure and clarifying the goals, because originally I talked about such topics as the ICC and how that related to corruption. And my focus was just all over the place. But apparently I need to hone it even more. So thank you for raising that issue. Ms. Kim? You brought up the example of China and how it's restricting the effectiveness of internet technology and disseminating information to the general public. That's a very valid point. I think I want to return to the topic of education and how education and technology should be used in tandem to effectively combat corruption. because China is such an interesting case because it claims to be a communist society, but clearly the rise of its economy is due to capitalist principles. So China is very familiar with the benefits of being a member of the global open market economy. I think that if we push that angle in conjunction with education by encouraging China's best and brightest academics, scholars, and scientists to engage in global projects with people from similar fields around the world, we can open channels of communication and perhaps work around issues of censorship in China.
I think it's a very organized paper. I'd like to start off with a very simplistic way of analyzing this problem. You accumulate debt if you spend more than you earn. So public spending is a bit like a household wife's budget, and that's the model that we can use. So even if you spend I think even if there is government expenditure on social spending on the unemployed, I don't think it necessarily leads to an increase in debt, provided that the income exceeds the expenditure. And I'd like to challenge your rationale. I think the rationale for your conclusion was that spending on social programs targeted to those already in employment is a redistribution to people who are productive, whereas spending on those who are unemployed is a redistribution to the unproductive. In my view, spending on the unemployed can be as productive as spending on the employed. If we provide $10,000 to an unemployed person, that person won't sit on it, but he would spend it. And in most countries, there is indirect taxation in the form of value-added tax. Depending on the rate, you will recover some of that spending back to the government. And those that are not returned to the government would be spent to service providers, who would be productive, or is likely to be productive. Another challenge to the rationale is that even if you can successfully defend against my just the criticism that I've just mentioned, I think I have to repeat and challenge the conventional understanding and say that again, public debt will increase if the spending on the employed would exceed the revenue generated from the employed people's productive activities. And I'm quite curious as to why there is so much focus, and I understand that you can't present such a broad paper at these kind of conferences, but why there is so much focus on social spending. There are many other types of government expenditure. I think it was Mr. Doe's paper, or someone else's paper, where there was an analysis or statistical data on US government spending. And a significant portion of the US government spending was in the Iraq War. I remember it was a purple box in that table that you've provided. You can have public debt even if you have absolutely no social spending. And I raise this point because I'm trying to understand the value of your conclusion. And looking at your methodology, I think housing and health have deliberately been, considered or in a different way, or excluded, to be more precise. But housing and health actually does benefit the employed in certain circumstances. It depends on what criteria the state applies to provide housing and health benefit. And the UK, a significant portion of government spending is on health and housing. And by not taking these into account into your statistical formula, I think I don't think the analysis is perfect, or as perfect as you would like. And I have some trouble with the income tax information that you've used for your analysis. You've used income tax, but that surely is insufficient to, and I don't understand exactly why you've considered income tax, but presumably it was taken into account so that you can take government income into account. But as I've said before, there's national insurance, capital gains tax, many other forms of taxation which generate revenue for the government. And not taking these into account, I think, reveals a fatal flaw with the statistical model that's been used. And I think looking outside the box and outside your paper, I think outside the scope of your paper, let us suppose that we accept everything you say. And what do you exactly propose after that? Should we just spend, or should there be social spending just on the employed? I think I can go on for hours as to whether social spending of any kind is justified, and I think one could say that the employed don't necessarily need much support from the government. So the conclusion here may be simply academic rather than practical. And I think you've mentioned pensions in your analysis. And yes, it does contribute to increase in public debt. But the pension entitlement doesn't come out of thin air, but it arises, and a person's entitled to pension benefits because he's paid for it. He's paid, usually contributed to pension benefits, so it's not free. So it doesn't necessarily follow that social spending on the unemployed should be cut. It doesn't take into account the relationship and the agreements between individuals. And I don't think one of the arguments you've raised is that commitment aspects make it extremely difficult to cut social spending. But all other forms of social spending is extremely difficult to cut. All forms of government spending is difficult to cut. If I suddenly propose, actually, I decide to make 50% of the civil service redundant tomorrow, because it's, I think that many people would be outraged by that. I think the commitment argument applies to all aspects of politics, and I'm not sure what value that adds to the debate we have here.
And,
okay, Philip.
Thank you.
Yeah, I think you've done a great job. Excellent comments. Like she would be overwhelmed if you keep going on. All right, Sojin, Jay, sorry.
Thank you for your great paper. It was a sort of paper that I'm not used to, but I'll try to give some helpful comments. One question that I have is that, as Philip said, I don't think we can neglect social spending for the unemployed, because first of all, there are aspects of value, that is, aspects of equality and justice. And I'm sure there are different kinds of unemployment, but in your paper you don't discuss those differences. And much of the social spending spent on the unemployed are spent in order to promote the unemployed to get jobs and train them the skills needed to take a good job. So I don't think social spending on unemployment is a waste, rather a sort of investment for like future income and future economic growth. And the second point is, I'm not familiar at all with statistics, but your statistical analysis focused on statistical significance in order to draw your results. But I'm wondering whether you used effect size statistics. And effect size statistics measures the strength of the relationship between two variables, so we can approximate the practical importance of the differences shown on the data. And I'm wondering whether you have any answers for that. And the third question is, in your paper, you talk about productivity and commitment as conventional wisdoms that you counter-argue, but I felt that you didn't really connect productivity and commitment well into your argument. So that part of your paper seems a bit aloof. And I think it would be better if you directly attack or some sort of counter-argument against productivity and commitment. Thank you.
I have pages and pages of notes due to your comments, and I'll try to address all of them if possible and as best as I can. I don't even know where to start because I wrote so messily. So, Philip, one of the things that you asked was, why are you focusing so much on social spending when there are so many other government expenditures in the world that can lead to a rise in the public debt level? And, well, I guess I should start with why I chose to write a paper on this and like how my interest became. I was in my world politics class fall semester. We had to read articles because we were getting quizzed on current events. I read about the France pension and the pension bill getting passed, or whether it will be passed or not, and the workers striking. And I was like, what is social spending? Why does it really matter? Like, I don't really care. It was just like a pure interest, as I thought that I wanted to become a political economist, but realized that I only enjoyed reading political economy, and I actually enjoyed the numerical aspect of it. And so I wanted to keep my paper focused in one thing and really just delve into the statistical part and like make sure that like in the beginning I really wrote my paper so that all my data fit into my hypothesis and that my hypothesis was correct in every way. But Professor Koo commented back after my first draft saying that it had no connections, as you said, Ms. Chung, and that it wasn't really fit to the theme of sustainability. So I really focused on one thing, which was social spending. And social spending in and out of itself has so many different little branches that I could have written hundreds and hundreds of pages of papers if I really focused on other social expenditures from governments. So I hope you understand why I kept it shortened to social spending. When you also talked about methodology, about me omitting housing and health, as you said, it really depends, like housing and health, it really depends as it could benefit both the unemployed and the employed, because housing and health, everyone needs it, as we learned from medical sustainability today in the presentation. And so initially I really didn't want to include aspects of social spending that I couldn't really clearly separate from that benefit to the unemployed and the employed. But in the end, I ended up adding in unemployment benefits, which really didn't have any statistical significance. But I'll keep that in mind. And what else was it? Income tax. You commented on why I only focused on income tax when there are so many other aspects to taxations. As I said before, I'm a math major. I really liked running the regressions. But even for me, there was so much data and so much regression to do, even with this set of income tax data, that I think that I just completely forgot to think about even more. So I'll keep that in mind when I try to improve my paper. And I'm in response to both your concerns about concerns saying that we shouldn't completely neglect social spending for the unemployed. That's not my point. I should say that my point is there should be a balance. And if we're really talking about the fiscal policy and really concerned about the rising level of public debt, we should really cut down, not like completely neglect, but there should be a balance so that social spending doesn't contribute more and more to the rising levels of public debt. What else? I'm sorry, there were so many notes.
Could I add a quick line of defense for Ms. Lee? In that, I think what she did was actually very interesting in that her aim of the presentation, of her paper, was to do a numerical analysis and compare spending on both and their relation to public debt. And that in itself, I don't think we need to conclude that we shouldn't spend on the unemployed. Rather, a conclusion may also be that to question how can we make public spending into the unemployed be a plus instead of, well, at least we know we have a mechanism now that we can assess that by. And her conclusion does not necessarily need to be kind of a dangerous one, and it can rather be a helpful one.
So like, Irun is advocating her position, like treating that as a scientific research, exactly, rather than proposing, reliable policies that can be applied. Okay, floor is open. I thought that we could secure plenty of time for the discussion from the floor, but this is my bad. But we've got like 5 to 10 minutes, like for the floor discussions. The floor is open.
I am more than impressed. I am more than impressed. The second session, especially all three students. I'm not sure anyway. And then I have. I'm quite impressed with Carol Kim. And what I wondering is, are you sure about GDP? Relationship between GDP and the CPI, and I have seen your essay. In the end of the essay, there was a table relation between CPI and GDP, and it shows the more higher GDP shows the lower CPI. It means economical growth can be kind of guarantee we can reduce the corruption and the CPI rate. And do you agree this, or you got any other view of this? Because your table clearly shows higher GDP and then lower CPI in your tables. Do you mind to clarify your opinion in this, please?
Other comments?
And then, okay, second, Mr. William Do, and I will make a short. I also thought, same as Philip Kim, there was a big risk to patient if the lower training staff for reduce the cost. And then I'm wondering, your model is, you can take example from NHS system from in the UK or in Korea or US. I'm wondering what is really you are more referring, is the Korean system you're suggesting, and or UK system you suggesting. I'm wondering that. And so another thing is that the IT link between patient and doctor. Actually, there I can see you are really doctor. Your point, and I really that is good idea. But in actually the IT is used already in so many people to access the information to so many medical information. It can be abused, too much overuse, and then will be dangerous. And then also pharmacy system is supporting as well. So, and what do you think about that system? And say the two questions. And then as the third list, I got very simply, certainly I really do impressed. She got a good conclusion of social spending is affected greatly to levels of public debt. And then I really, it is in this time of in Korea, her point of view is highly valued, and then I'm really impressed. And thanks for all your three contributions. So I got the question to first to Carol, and secondly in Ilhon, please. Okay, thank you very much.
So would you please identify yourself?
Oh, I am Philip Kim's mother, and I working for Concert Music Service. I have traveling with him to Korea, and I really want to see this conference again. I have been here last year, and then I was impressed as well. But this year more impressive than last year. All excellent, really smart students are here, and so this atmosphere and professors actually made the relaxed atmosphere, and I am really happy to be here as well.
Thanks,
so,
Mother.
Thank you.
So other questions from the floor? Please identify yourself before raising your question. One more. Yeah.
Well, I'm Carol Kim's father, so I have 25 questions to my daughter. No, my question is to Sojin Lee. Well, suppose all your findings are correct, okay? And that with all due respect to your findings, social program is inherently built that way. There is a special purpose. So it's a little controversial and at the same time provocative. And also, given the technicality of your model, and if I understand it correctly, in table 2, first 2 columns are for specifically targeted to unemployed. But in my opinion, first column is old age pension, second column is unemployment benefits. Well, regardless of employment the status, and then people get into old age. So I'm not quite sure, and I'm not quite convinced, and how old age pension and unemployment benefits are kind of proxy for the unemployed.
So presenters respond very quickly.
Yes.
Okay? Just,
thank you.
To the most essential questions. Pick one.
Okay, I'll go first then. I'll make it as concise as possible. With respect to which country I refer to, and Prof asked a similar question, I think it refers to every country because the fundamental problem that I mentioned is regarding the business model of delivery, of healthcare delivery, which is a hospital and a clinic, which is in every single country in the world. And so the innovation I propose is going to work for is going to apply to every country. And the differences between countries is just regarding the method of funding or where the money comes from at the end of the day. In terms of IT, I acknowledge that already there's so much information out on the web and there's not much regulation. However, I propose that by having doctors or more medically assured advice pushed to the patient. To give a quick example is, there's a thing called Text for Babies in the UK, where if you're a pregnant mom, you can give, when you became, or your rough date of expected delivery, and then at certain points, you would get a text, for example, saying, oh, you should be careful of alcohol between months 1 and 2, for example. And by having more services that push good information to the patient, then we'll be able to safeguard IT a bit more. And there's many more things that I could say, but I'll keep it to that for now. Thanks.
I agree with you, Mr. Kim, in that you don't know how it really connects to the unemployed. None of my data for column 2 unemployment benefits were statistically significant, and so I was wondering, like, why is that? Because I was so sure that unemployment benefits were targeted to the unemployed, and the conclusion that I came to was because not everyone who is unemployed that the government deems unemployed is unemployed. Because, for example, tutoring, babysitting, you don't really get taxed. You don't report to the government, hey, I'm getting paid, so why don't you tax me? Because you can just get it out of the person's pocket. So that's all I can say for that reason. Thank you.
Smile with your mother.
That's a very good point. Because in my definition of sustainability, I propose that sustainability is the long-term maintenance of economic well-being. In my analysis of the variables of CPI and GDP per capita, I focused more on the the trend of low CPI being linked, or no, high CPI, which I want to clarify means low corruption, being linked to higher GDP per capita, and conversely, lower CPI being linked to lower GDP per capita. But Mr. Kim's mother pointed out that if you look at the table in my appendix, there are quite a few countries that have high GDP but low CPI scores, indicating a high amount of corruption. During my presentation, I didn't really delve into the methodology behind calculating CPI scores due to time limitations. But the Corruption Perception Index, as the name would indicate, is based heavily on the public's perception of the amount of corruption in a nation. And so this can be influenced by factors depending on that nation's culture or its political system. For example, certain nations, their cultures they put a lot of value on, saving face and not speaking out publicly. So people who were surveyed when calculating a CPI might have been a bit hesitant to be forthcoming about every aspect of potential corruption in their society. Also, the definition of corruption tends to vary from nation to nation and culture to culture. For example, bribery is really taboo in some cultures, but it's normal, practically quotidian in other cultures. And in more developed nations, corruption can have existed for such a long time that it's been embedded within the political system. So it doesn't surface the same way that it would in a less developed nation. So all these factors might account for the variations in the link between CPI score and GDP per capita.
Thank you, Carol. It's 5:49. I feel like I've learned quite a bit about different fields of sustainability. I think the audience would feel the same way. Thank you for all the presenters, discussants, as well as the audience who has been really being patient about the prolonged session. Thank you so much.